So writing workshop, the primary goals are sentence construction and accuracy enhancement. Andrea Kim. So Mrs. Andrea Kim. Breast cancer. Forty-seven years of age. So get ready for the show. Mrs. Andrea Kim, breast cancer. Right. Stage 2. So take your notebooks and the quality sentences you'll be learning. Try to use them. Mrs. Andrea Kim, breast cancer, right, stage 2. This is the case notes. Here is the pages. You can take them. Now I'll send you the PDF also. Here is the PDF. So go through the case notes. Yeah. So I'll be explaining, and afterwards you can write. So this is the end of second page, and this is the third page. Yes. So now step by step we'll be following. We'll be following on a step by step basis. Okay, number one. Okay, we have 7 components. We have 7 components. So this is OET, letter, writing, task. Okay, so we are going to write 7 components. 7 components. So we'll be dealing with them one by one. One by one. So first one, let us take the address. Okay. Let us take number one, the address. Yes. Now, what will you write in the first line? What will you write in the first line? What will you write in the first line? Yeah, name or designation. No? I know name or designation. Okay, first here, according to this letter, what will come? Name or designation? Which will come first? All of you participate actively, please. Here you have. So name. No need to send a direct message, Rifa. Send it to everyone, because if you whenever you type me personally, then every time I have to change to everyone. No problem. It's okay. No need to say sorry. No need to say. No problem. It's okay. So what will you write in the first line? You tell me. Based on that one, I will also follow. First line. So address. What are we going to write in the first line? So what is the name? Come on, tell me. Joseph Smith. So will you write Joseph Smith like that only, Dalvi? Will you write Joseph Smith? Is it a doctor or Mr. or something you have to write, right? So surgical center may not be a doctor, maybe a doctor also. Okay, surgical center, maybe a doctor or may not be doctor. So better to write Mr. Joseph Smith. Yeah. So are you writing to Mr. Joseph Smith? Yeah. So that is Mr. Joseph Smith. Okay. We are writing to Mr. Joseph Smith. Okay, let us take that. Mr. Joseph Smith. Okay. So let us take here. And is there anything here? Here anything information is given? Past surgical history. So St. John's Surgical Center. Surgical Center. Maybe you are writing to a doctor. Maybe. Or maybe you're writing to a person who is managing and he's not a doctor. Maybe possible. So you have to be reasonable here. If anything is given, checking here. So nothing is given here. You're writing to St. John's, Joseph Smith, technician. Yeah, here it is. He's a technician. So technician is not a doctor. So you can write next line is designation. Technician. Yeah, technician. So is that right? Do you think a technician is right? Okay. So what do you? Okay, I wrote a technician because Mr. Joseph Smith is a technician. I wrote Joseph Smith. What do you think? Do you think if it is a technician, you write technician? If it is a doctor, you write doctor? The technician. Do you think that he is the only technician there? Do you think that he is the only technician? That's you are writing the technician. He may be one of the technicians. So definitely the is needed or not needed. Check it out. I wrote just a technician, but do you think that the technician is right? All of you participate. Okay, not needed. So then you can write, yeah, technician. Next, what is the third line? What will you write in the third line? Yeah, first, all of you write down first line, second line, write down. If you can write all the lines together also, you can write. So what do you think will come in the third line? Okay. So I think St. John's Surgical Center. I think like that. Then what about you? You write your own. I will write my own. Okay. St. John's Surgical Center. Okay, you can see here. So Joseph Smith. So Mr. Joseph Smith, technician, St. John Surgical Center. Okay, is there anything given there? Any address or any other thing? Nothing. That's it. And okay, anything else given in the way? You are a pre-operative care nurse at St. John Surgical. You are there only. You are also working there. So the same hospital. Okay, same hospital. Any hospital name is given or anything is given. So you are also working there as a pre-operative care nurse at St. George's Surgical Center, and you are writing to a technician. That's all. Yeah. Yes, that's done. So do you think everything is done or do you need anything else here? If it is completed, say write done. Okay, only 3 lines I write. And what about you? If it is finished according to the information provided here, write a letter to Joseph Smith, technician, St. John Surgical Center. That's it. So finished. Now let us, so this is these are the points. Okay, fine. Right. So file save as, yeah. So here it is lecture notes. Yeah, right. So fine, so far so good. Then next one, what I have to do is, yeah, I'll open our single page. Yeah, this is our single page. Okay, let us take this one. So organize pages 1, 2, 3, 4, 5, 6, 7. Yeah, I think that's enough. Fine. Okay, we'll take one more, no problem. So this is the first page. So here, right. So Joseph Smith, okay. Mr. Joseph Smith. Okay, that's it. First line. Okay, fine. And second line. So this is how you have to write. Left margin, we call this. Left margin. Yeah. To maintain the left margin like this. Next one is technician. 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 So this also you have to maintain in the margin. Yeah. Technician. So let us keep it a little bigger. So that's fine, I suppose. So Mr. Joseph Smith, technician, 3/4. Yeah, that style is fine. Mr. Joseph Smith, technician. Then St. John's, St. John's apostrophe surgical center, finished. So we got it done. Then next leave one line. Leave one line. And then what you have to write? So the date. So what is the date that you are going to write? So this is 18 January 2020, pre-operative orders carried out, anesthesia, everything. So when are you writing this letter? Is there today's date? Today's date. So date. Can you write the date 18 January 2022? Or here it is 18 January 2022. Here is also there and here also it is there. So, right. So now the date we'll write like this, 18 January 2022. Yeah, let us take this date, 18 January. All of you write down now. Why are you not writing? Participate seriously. Na? Otherwise, I will not write. Only you will write them. I'm just guiding you. In the exam, who is going to help you? Nobody. So leave one line. and write the date. So that means after every topic, so this is the address, then this is the date. After every topic you have to, okay, you are not seriously participating, so I'll call some students, so participation will be there and I'll get encouragement. Yeah. 1, 2, 3. Oh, so so remove this one. Yeah, 18 January 2022. Yeah. Yes, 18 January 2022. Fine. Next, the third one is the salutation. Salutation. So you'll write number 3, salutation. How do you write? Dear Mr. Smith. Okay. Rajeshwari Ram has written Dear Mr. Smith. Okay. How do you know that you should be writing Dear Mr. Smith? So let us tell you. Let us go to the address. So this title called Mr. and the second name Smith should come. And you have to write comma. After address, sorry, after salutation, you have to put comma. So let us take a salutation number 3. So dear Mr. Smith, comma. That is how you will write. That is salutation. So that is salutation. So leave again another line and write salutation. Dear Mr. Smith. Yeah, come on, write down all of you. Please, please participate. Please participate. Okay. There are only few students. If you don't participate, what is the benefit? Tell me. Hmm? Yeah. So who is participating actively? So Rajeshwari, then Srija, Delvi, Srija, Kamal, and Rajeshwari. Okay, right. It's okay. People are busy. Maybe we have to accept the fact. Ne? Next one, fourth one. Fourth one will be the subject line. So subject line. How are you going to write the subject line now? You have to go to the beginning. Yeah. So you have to go to the beginning. Yes. This is Mrs. Andrea Kim, comma, aged. Aged no need. You should not write aged here because both are given. Date of birth 6. Okay, 6 April 1974. So that is one way of writing. Mrs. Andrea Kim, aged 47, not 42, 47. That's okay. No problem. So these are the two varieties, but the best variety is first one. If date of birth is not given, then you have to write age. Okay. So the best option is this one, double right. And this is only single right. This is only single right. And this is the best option is double right. If both are there, then you have to write. Okay. No, don't write any other thing. Just these two formats are best. If you do something else, there may be problem. Regarding, Okay. After regarding, space should be there. Rajeshwari. Space. Oh, sorry. I did not write regarding. Okay. Regarding column space. Regarding column space. Space should be there. Space should be there. So, right. So, I'm increasing the participation so that yeah. So, these are the two varieties. So, the best variety is the first one. Okay. So, this is the first variety. It's the best variety. If it is not there, date of birth is not given, then you can write. Okay. This is the first option. So, write like this. If this is not there, then you can write aged. So, it is already there. So, no need to write the second option. Then you will have the body of the letter. So, body. The body. So here you will have introduction. Okay. First you will write the introduction. Okay. Then next body paragraph 1. BOD. The main. This is the main body paragraph. Main body paragraph 1. Main body paragraph 1. Okay. Then you will have the main body paragraph 2. The main body paragraph 2. Then you will write the main body paragraph 3. Okay. Then you will write the conclusion. The conclusion. And this is the introduction. So 5 paragraphs you will write. After these 5 paragraphs, you will write the closing remarks. The closing remarks. That is yours faithfully or yours sincerely. Which one do you think will write to this letter? Because it is Mr. Joseph Smith. So will you write yours faithfully or yours sincerely? Okay, leave one more line here and you have to write that one. So yours. Come on, write down. All of you give me. I don't know what to write. So you tell me what we should write. Okay. After yours sincerely, you should put comma. Anita Pachigola. You have to put a comma. So there is a little more participation now. Active students are participating. Let me note down who is participating actively. Okay. Yeah. Yours sincerely. Dalvi, will you write capital letter? Rifa, faithfully. Will you write faithfully? Because you know the person's name. Okay. So if you know the person's name given, name known, name known. So it should be yours sincerely, comma. Name unknown. It should be yours faithfully. So name known, known unknown. So it should be yours sincerely. Okay, now leave 2 lines, 1 and 2. Leave 2 lines. Then you will write about your address. So yours sincerely. So here we wrote already. And subject line. We finished. Salutation, 4 things we finished. Next, the 6th one. 6th one will be, yeah. 6th one will be yours sincerely. So yours sincerely, that's what you are writing. Then your address. Your address will be at the top. Your address will be at the top. You are a pre-operative nurse. Remember that. Pre-operative care nurse. So that is your address. Pre-operative care nurse. Pre-operative care nurse. Preoperative care nurse. Then where preoperative care nurse. So preoperative ward. So registered nurse, preoperative ward, or inpatient ward, something. Inpatient ward, preoperative, postoperative, inpatient, outpatient. There will be one words. Many places they will be given like this one. Okay, pre-operative, but Cambridge Dictionary says it's one word. So this may be also in use. Okay, inpatient ward, and St. John's apostrophe S, St. John's Surgical Center. See, capitals are not given. St. John's Surgical Center. Capital should be there. Capitals should be there. Okay. Capital letters must be there for the name of the center. So St. John's Surgical Center. So that's it. So preoperative care nurse, inpatient ward, St. John's Surgical Center. Name of the city or street or anything is given. Nothing is given. Nothing else is given. Okay, fine. Okay. Yeah. So we'll take this one as it is and we'll write here. Yeah. So 2 lines, leave 2 lines here because that is how they are. It is in the case notes. Preoperative care nurse. Okay. Preoperative care nurse. Next one. Inpatient ward. Inpatient ward. Okay. Next line. St. John apostrophe S Surgical Center. Yeah. So that's it. So come on, write down your address. What address you want to write? I don't know what address you will write. So take care of this one. You write your own address, no problem. Okay. Yeah. Yes. So write down the address. All of you participate. Preoperative care nurse, C capital letter, nurse N capital letter, Kamal Takar. St. John's ST full stop. John's surgical S capital letter, center C capital letter. Rewrite. Anybody has done mistake? See the format. Here in the case notes it is wrong, but in the official notes it will not be like this. In the official notes it will be correct. Yeah, hyphen no need actually, officially no need. But some people write like this. Maybe that is given. That's not a big crime, but that's okay. If you write, there is nothing much problem. Yeah. Kamal Takar, surgical center, yes, capital letter, C capital letter again. Sent ST full stop. Rewrite Kamal Takar, rewrite with surgical S capital letter, C capital letter, and Anita Dazzle. From where Anita Dazzle came here? Where is Anita Dazzle? Who is Anita Dazzle? And where is this Queen Elizabeth Health Center? Where is Birmingham? Is it written anywhere? Anita Pachugula, is it written anywhere? So this letter we are writing, no? So write according to this letter. Okay. No problem. It's okay. So you are written, that's not a problem, but check this letter. We are writing this letter now, otherwise others will get confused. So I only got confused. Where is this Birmingham? I was thinking because 2-3 times I went up and down. I did not get anywhere Birmingham. So actually, if I am confused, then everyone will get confused. Nah? Yeah. So the number is increasing. Good. Yes, Rifa Taranam. Very good. Correct. Address same, no problem, but you can write there. Nah? So that we'll know from the same place to same place it's going at least. We should know now from where it is coming, where it is going. It is compulsory. Yeah. Good evening, Kiran. Yeah. Come on. Yes. Now let us go for the introduction. What are the points which go in the introduction? Now let us see. Sukhvinder, Vinita Ramakrishna, Sukhvinder Kaur, Srija, Ravindran, Rifa Tarnam, Ramesh, Rajeshwari, Ram, regular, all are regular students. Yeah, Muhammad is a guest. And Kiran Delhi. Yeah, Kiran Delhi. Kamal Thakkar, Hafsa Fatima, Dalvi Yogendra, Anil, Avil Kenwith, Anita Pachigola. All are regular students. Only one guest is there. That is Muhammad. Welcome, Muhammad. So, right. Next. Yeah. Now we are going to write the introduction. We are going to the body. We are focusing on the body of the letter. We are going to the body of the letter. So, in the body of the letter, what are we supposed to write? Now let us check. What do you think will go into the body of the letter? So the introduction, the introduction, the introduction. What will go into the introduction? What are the points that will go into the introduction? So let us take those points here. What are the points will go into the introduction? Come on, let us check here. A diagnosis. Okay, diagnosis. Okay, I will say diagnosis. Diagnosis. Okay, then Srija says purpose. Very good. Everyone is giving points. Very good. Purpose of the letter. Okay, diagnosis. Diagnosis, purpose of the letter. Come on, what else? Who is referring? Okay, who is writing or who is referring? Okay. So is this what type of letter? What type of letter? What type of letter is this? Okay. So what is the diagnosis? What is the purpose? Okay, what type of letter and what else? What else? Reason for referral, that is purpose. Why is he is referring his reason, that is purpose. Yeah. Who is the reader? Yeah, who is the reader? So who is the reader? Reader is the addressee. So I don't think that is needed. A reader, because already in the address it is there. What care is needed? Okay. What action is needed? That is purpose. What care is needed is again purpose. Okay. All right. Now, so diagnosis. What is the purpose? Type of letter, requirement, destination. Yeah, destination. Okay. And next one, patient's name. Yeah, that is important. Name of the patient. Patient's name. Yeah. Patient's name is important. Anything else? So where will we find the diagnosis? Diagnosis we found here, diagnosis. He was diagnosed with breast cancer, right. Breast cancer, right. Stage 2. Yeah. And what is the purpose? Where will you get the purpose? Now let us take this one to the third page. Here you will get purpose. Yeah. So writing task. What is the purpose? Write a letter to Joseph Smith, the technician, and update him. So this is a letter updating information. Okay. So updating the information regarding the patient's condition and preoperative measures taken. So what all action taken? Updating the present health condition. So updating the present health condition. Yeah, updating the present health condition. Then next one, and what are the preoperative measures taken? Preoperative measures taken. You have to tell what measures you have taken there. Then, right, regarding the patient's condition and preoperative measures taken. And patient anxiety, obvious need emotional support. Closely monitor. So all these things are needed. Okay. 18 January, all these points. All these points are pre-operative operative 18 January, what all the things you have taken. So this present condition, everything you are telling. So what else? What else you think is needed here? Come on. Yeah. So now you can write the introduction. Write your own introduction. Write your own introduction, please. Yeah. So we are taking this and we are going to write introduction. Yeah. Write your own introduction. So how are you going to write? How do you want to start? Name of the patient. What is the name of the patient? You know that one. What is the name of the patient? Yeah, Mrs. Andrea Kim. Okay, that is the name of the patient. Okay, that also is needed. Here, come on, think about the sentence. How you are going to write? Write down. Take 3 to 5 minutes to write. Okay. Write your introduction. Yeah, write your own styles. So the words which you are going to write are, so Mrs. Kim, comma, this is one you can write, diagnosed with stage 2 cancer, stage 2 cancer. Stage 2 cancer, breast cancer, right, stage 2. So use all these things. Okay. Okay, you can always rewrite. Something is missing, you can copy and write. Na? Write the name. So Mrs. Kim diagnosed with breast cancer, right? Stage 2. Yeah, all of you can write. Then scheduled for what? This also is there. Not only diagnosed. Yeah. Procedure, right, mastectomy plus biopsy elective. So right, mastectomy and biopsy elective. Okay. Whichever you want to use, you can use. Yeah. So scheduled, this program is scheduled. Who is about to undergo? Okay. Right. So updating the present health condition and preoperative measures undertaken. Okay. Then what else? So she requires what? Requires what? Yeah, you can write your own introduction. I'm writing, okay, let us see what you have written and who has written. So I'm writing to update the current health condition, the current. Always write current, previous, past, the current, the present, the previous, the past, the prior, the earlier, the following, the later, the former, the latter, the next, the following. So all these things should be written with the. I'm writing to update the current health condition of Mrs. Kim, who has been diagnosed with stage 2 breast cancer. She is scheduled for surgery and requires pre-operative management and emotional support. That you already gave, na? That you already gave. Kiran Kaur case notes I already sent in the group. Case notes, Kiran Kaurai, case notes I already sent in the group and Telegram channel. Imma, what is your second name? Second name, please. Imma is another guest today. Okay. Yeah. So, yeah. Immaculate. Immaculate Mary. Great. Immaculate. Simon sir tells only good for you, right? For everyone. Very good. You are here. Attend regularly. Immaculate Mary. Yes, Simon sir always says good only. Okay. People should listen. If you all listen, I'll be very happy. Immaculate Mary, is that your full name? Yeah. Yeah, come on, please. Write down your. Yeah. So, Srija Ravindran Kamal Thakkar. I am writing to update the current health condition of Mrs. Kim, who has been diagnosed or who was diagnosed with stage 2 breast cancer. Was diagnosed maybe 1 day, 2 days before diagnosed. Who was diagnosed with stage 2 was is better. Who was diagnosed with stage 2 breast cancer. She uh, is scheduled. She has been scheduled for surgery and requires pre-operative management. She has already been provided. Okay. And emotional support. Okay, fine. I am writing to update you regarding Mrs. Andrea Kim, who was diagnosed after comma spaces who was admitted with a diagnosis of who was diagnosed with finished of breast cancer and is scheduled for right mastectomy today. She requires psychological support and continuous spelling CONTINUOUS. Write 10 times the spelling so that you will not miss next time. Monitoring of blood pressure, BP, you can write blood pressure during the perioperative period. Rifat Taranam, I'm writing to let you know that the patient is patient. Don't use the word patient. It doesn't find. It doesn't see anybody. If you tell me patient, I feel very sad. If you tell that my son is a patient, I'll feel very sad. I'll be angry also. So don't use the name patient as far as possible, because patient will take the letter, so he may read the letter also. So avoid the word patient as far as possible because it's not a designation like doctor. So doctor, if I say doctor means you'll be proud of. If I say nurse, you'll be proud of. A patient, if I say, will not be very happy, very comfortable. So very good. So not had been, has been is okay or was is okay. Had been is past perfect. You cannot use past perfect like that. So was is okay or has been. Was means past tense. Has been present perfect. Both are okay. But had been means okay, that's different. So two things in the past, then you can use had been. But here no need. One thing only. So was or has been. Yeah. Come on, write down your sentences, please. Introduction. Yeah. Come on, come on. I'm waiting for you people. Yeah. So that is the introduction. How many? Only 3 students have written. Very sad. Kamal Thakkar, Srija Ravindran, and Rifat Taranam. What about the others? Write down. If it is wrong, also write down. No, try at least something. If you are new, then you can see how others are writing and you can use them. Okay. Yeah. So then we'll go to the second paragraph. Yeah, very good. I will carry with Mrs. Kim, who was diagnosed with right breast cancer, has been scheduled. Who has Mrs. Kim, who was diagnosed with right breast cancer, comma, is scheduled for. She is not needed. Na put comma and remove she because this is a complex sentence. So put a comma there. It's a continuation. Na? So who was diagnosed with right breast cancer? She was. She is scheduled for right mastectomy surgery today. Full stop. She requires not only preoperative management. So I'm updating. Okay, regarding is being so this is to update you regarding the preoperative measures taken and also the emotional support needed. So like that also you can change the second sentence. So she requires not only preoperative measures have been taken, preoperative measures taken, finished. Okay. She education regarding preoperative measures has been provided, but she requires emotional support. Like that you can modify. Okay, otherwise it's fine. Yeah, next. Others. 4 students have written so far. If you cannot write the introduction, then how you can write the main body of the letter? Write something, even if it is wrong also, it's okay. Nobody is bothered. No one will think wrong. Everyone is learning. Yeah. Come on, try your level best. Students are increasing in number. Very good. That's good participation. We're going to learn a lot of things. Quality sentences. We should remember our motto today. What are we for here? What are our primary goals? Sentence construction and accuracy enhancement. Our primary goal, yeah, sentence construction. How we are writing sentences and how to achieve accuracy, enhance, improve our quality. So that is what we are here for. Come on, come on. So introduction. So next, only last 3 minutes, and then we'll move to the main body paragraph 1. Okay, 2 minutes more. Very good, Hafsa Fatima. Very good. So you all are participating. Very nice. Thank you for seeing Miss Andrea Kim. I am writing to signpost you about her confirmed ailment of second stage right breast cancer, for which she has been scheduled for, is better. Okay, planned, no, planned, PLA double N, planned for surgery. And preoperative care has been, instructions regarding preoperative measures have been provided. So like that you can modify, that's fine. Okay, it's good idea, good points. Okay, good points. Some modifications we can make, no problem. These are the first stage. No? This is the first stage. No? Definitely you'll improve in the long run. So try it, write. Instead of being silent, writing something is always better. Yeah. So one more minute, Anita Pachigola, very good. I'm writing to update the current health status of Mrs. Kim. Signpost means indicate, inform you. Okay, I'm writing to update the current health status of Mrs. Kim, who was diagnosed with stage 2 breast cancer and requires pre-operative management and emotional support. So pre-operative management you have already provided. All right. Next, Kiran Delhi, Mrs. Kim, who has been scheduled an invasive procedure of the right side in mastectomy with elective biopsy following stage 2 right side breast cancer. There is not needed. Stage 2 right side breast cancer. Breast cancer on the right side, or requires not only the ongoing preoperative evaluation, appropriate management, but also preoperative evaluation. It's already given. Preoperative measures already taken. You have to tell them what are the preoperative measures that are taken. Okay. Then, but also psychological support. So it will modify that one. Preoperative evaluation. She not requires, but she is already provided. To update you regarding the preoperative measures taken. Okay, Saker. Saker is a new candidate. Very good. Welcome to our platform, Saker. I'm writing to update you about Mrs. Kim, who underwent stage 2, right? Who is going to undergo, who has been scheduled. Okay, not underwent. It's not finished. Not finished. Okay. So all the preoperative management has been provided, given, but requires your emotional support. Okay, fine. Little modification. Otherwise, fine. Yeah, good. Now let us go to the main body paragraph. Main body paragraph 1. What will you write in the main body paragraph 1? So, what are you going to write in the main body paragraph 1? Let me take you to our Telegram channel. Okay. Yeah. So, which Kim, Andrea Kim. Andrea Kim, case notes is here. This is Mrs. Andrea Kim from our case notes. Okay. Right. Till now, nobody submitted this letter for us. Yeah. This is today's video. Link is here. Yeah. I am waiting. No, I am writing. Maybe by mistake you have typed like that. That's fine. I'm writing to update Muhammad. The current health status of Mrs. Kim. Andrea, not Andrew, it's Andrea. Andrew is a boy's name. Andrea Kim, K capital letter. No problem, I can understand. She has been diagnosed with breast cancer, stage 2, for which scheduled for which right mastectomy has been scheduled. She requires preoperative. She has been provided care. She has been provided preoperative care, but requires psychological support. Like that, you have to modify. Yeah, that's okay. Mistakes everyone will do. We have to correct, that's all. So in your main writing, you can correct that. So that's fine. Now let us go to body paragraph 1, main body paragraph 1. What do you think we will write in the main body paragraph 1? Main body paragraph 1. Paragraph 1. 1. What do you think you will write? What do you think should go into the main body paragraph 1? Yeah. Come on, tell me. Reason for admission, chief complaints. Yasimi Mrs. Kim, who was diagnosed with stage 2 right breast cancer, has been scheduled for mastectomy. She requires preoperative. She has been provided preoperative care but requires psychological support. So current hospitalization and details, current health status. Okay. Rifa Taranam, again it's coming to personal. So I can change it to everyone. Yeah, Rifa Taranam, everyone. Very good. Fine. Yeah. So current health status, main complaints, current status, current. Yeah. Okay, fine. Now let us see here. Yeah. Recent nurse. Recent means current medical history, recent nursing notes. Okay. So breast cancer, mother died in 2002. Family history of breast cancer. Yeah. So management and current health status. Okay. Yeah, everyone in the meeting. Yes. Now check. What are the points which you want to write in the current status? We can write about the current status or hospitalization. Okay. Recent medical history. Okay. This is past medical history. Current medical history. Recent nursing notes. Yeah. This is pre-operative orders carried out. This will go in the yes. Transfer to patient. Transfer the patient to OR. OR means what? OR means operation room. Huh? Actually, OT will say operation theater. And operation room, operation theater, both are yeah fine. Normally, I heard OT. OT means operation theater. Okay, that's what I was thinking. That's fine. So all these things. Okay, fine. Now, so we'll start about the first paragraph. So now we can think what are the points which you want to write. Take me there. You give me what you want to write about. So you give me one point, I'll take you there. Yes. So paragraph number 1. Para 1. Yeah. What point you want to write? I'm flipping the pages. Where you want to take? Social history, planned procedure, past medical history, past surgical history, which topic? So you want me to take to current medical history. Okay, current medical history is here. Okay, current medical history is here, Anita Pachugola. So what do you think, all of you? Shall we stick on here? Yeah, current medical history. What about others? If you want to stick on to current medical history, recent medical, history. Current medical history means recent only. Same, both are same. So we'll stick on here. So 3 names are there. So Anita, Vinita, and Kiran, 3 of them have told. So we'll go to current medical history. Okay. Now, yeah, come on. So 2nd August, mammography, biopsy, diagnosis confirmed. And 10th August, diagnosis confirmed. Okay, on 10th August, that means diagnosed on 10th August. And today is what date? Do you remember today is what date? Present date, you remember here. Today's date is 18th January. That means you have to say was diagnosed, not has been diagnosed. Remember that now. So it is diagnosis on 10th August. Diagnosis on 10th August 2021, 1 year before. Diagnosis on 10 August, confirmed. 10 August, diagnosis confirmed. Now you will say was diagnosed. Today's date. Today's date. Today's date. Today's date is what? 18th January 2022. You should know that one. Now you will say has been diagnosed means present tense. Has been 18th January 2020. Yeah, has been diagnosed is present tense. Present perfect tense. Okay. Was diagnosed is past simple tense. Which do you think is better, present or past? Because it is how many months before, you can see there. So which is correct, you think? So according to your opinion, has been diagnosed or was diagnosed, which is better? Okay. Come on, tell me. Has been diagnosed means present. Present means now. Recently diagnosed. Okay. Recently diagnosed, that is it. So this is months before. August, September, October, November, December, January. Okay. So it should be was diagnosed. So use simple past tense. Okay. Use simple past tense. Come on. Yeah, you can write. Whatever you want to write, you can write. So don't use has been diagnosed. Better use was diagnosed. It appears to be right only. But the thing is, see the other things. Considering everything. Yeah. This curable disease so has been. What is curable disease? Has been. Oh, has been. I did not get. It is not a curable disease or incurable disease, whatever it is. But it is when it was diagnosed. Diagnosis. Now or in the past. So 5 months back it was diagnosed. I'm not talking about had been is not right, Dalvi. Had been means 2 past tenses should be there. And the past of the past is past perfect. Had been is past perfect. You cannot use past perfect here. It's ruled out totally. Past perfect is totally ruled out. You can use either simple past or present perfect. Present perfect means now or recently. Today, this week, this month, this fortnight, or this year. When you say this year, it's even past year, not last year, before last month, before last week, long back. This is not today or not even this week, not even this fortnight, not even this month, not even this year. It is last year. So see the difference. 5 months back. So it should be simple past. Okay. So there is no question. It's not whether curable disease or incurable disease. There is no relation. This action diagnosis happened now or in the past? One day before also was diagnosed yesterday. Otherwise, you have to say this week she was diagnosed. So this week she is diagnosed or she has been diagnosed. Okay. Come on, come on, come on. Okay, and write down now. What are the sentences you want to write? You can write down. On 17 January 2021, very good date you brought in the first. Mrs. Kim was electively admitted for the surgery and biopsy after the confirmation of diagnosis on 10th. On 2nd August 2021, breast cancer was preliminary diagnosis. Mammography. Okay. Mammography was conducted and the signs and symptoms suggested breast cancer. There's a possibility of breast cancer. Breast cancer was suspected. So you can say breast cancer was suspected. Sorry. Breast cancer was suspected following the mammography. Okay. We can say on 02 August 2021, mammography was performed or conducted. Okay, mammography was conducted and consequently and subsequently, breast cancer was suspected. Yeah. Okay. On 2nd August 2021, mammography was conducted and subsequently breast cancer was suspected. So, now do you agree with this sentence? How many of you agree with this sentence? Maybe right, maybe wrong. You see how it is. You have to create your own sentences. Otherwise, I'm just giving you some suggestions. It may be right, it may be wrong. It may be right, it may be wrong. 1 point, 1 sentence. So if you agree, you can say agree. If you disagree, you change your sentence and write. There is no problem. On 2 August 2021, mammography was conducted and subsequently breast cancer was suspected. Okay. According to the mammography, which was conducted on based on the mammography which was conducted on 2 August 2021, breast cancer based on the mammography based on the mammography which was conducted on 2 August 2021, breast cancer was preliminarily diagnosed. So based on, I'm giving you some sentences just like that. Based on the mammography, which was conducted on 2nd August 2021, breast cancer was preliminarily diagnosed. Preliminary diagnosis or preliminary diagnosis. Let me check. Preliminarily is this word apt. Prelimin. Preliminarily, very good. That's there. In a way that gives a first answer or decision, but not a final one. Yeah, that's absolutely right. This is a formal word and it's very perfectly apt, because you should know whether it is preliminary diagnosis, preliminarily diagnosed. Yeah. So very good word. It's a formal word which you can use. Those who are really serious students, come on, participate. Write your own sentence. Miss Kim complained about chest pain. Okay. Right. On 2nd August 2021, August A, capital letter RIFA. Mammography was done and later the diagnosis was confirmed after biopsy. Okay. After a week, during the following week, biopsy was conducted, which was conducted confirmed the diagnosis. During the following week, the biopsy, which was performed which was conducted earlier. The biopsy which was performed confirmed the diagnosis. There is no I, there is no we, there is no you, there is no he. During the following week, the biopsy which was performed confirmed the diagnosis. Or the biopsy which was performed during the following week confirmed the diagnosis. Okay. Yeah. So another sentence, the first one, developed severe pain, right chest region, 1 month. So Mrs. Kim, okay. So Sukhvinder, mammography, which was performed on 2nd August, confirmed a preliminary diagnosis, which should not be there after 21. Mammography, comma, which was performed on 2nd August. So which should go before and come after mammography. Mammography, comma, which was performed. Okay. Yeah, I will on 10 August, biopsy was performed and the diagnosis was confirmed. Yeah, right. For 1 month. So Miss Kim developed severe pain in the right chest, or severe pain in the right chest for almost a month was reported. Severe pain in the severe pain in the right side of the chest region. Severe pain in the right side of the chest region for almost severe pain in the right side of the chest region has been was reported. Past tense में was reported. Severe pain for almost 1 month. For 1 month. Okay. Severe pain for 1 month. Severe pain for 1 month in the right side of the chest region. Or you can also write severe pain in the right side of the chest region for 1 month was reported. Or she developed, Mrs. Kim developed severe pain in the right side. This is active voice, that is passive voice. Right side of the chest region for 1 month. Ms. Kim developed severe pain. Mrs. Kim developed severe pain in the right side of the chest region for 1 month. Very good. Today, too many students are participating. Very good. Participate like this every day. No? Yeah, write down your own sentences. What else you want to write in the first paragraph? It's okay. Right side of breast. In the right side breast, you can say, not right side of breast. Which breast, left or right? It's confusion. So, right side of the chest is okay. Right side of breast is not right. Chest is only one. You have right side and left side of the chest, but breast is, you say wrong. So, careful. Sukhvinder. Because chest is only one. Your number is important here. One means right side, left side, you can say. Okay. You can say right breast. Come on. So who is this? Hafsa Fatima. Advised. She was advised. SED, not CED. Initially, Mrs. Kim, not Miss Kim, Mrs. Kim had severe right chest. Right chest. How many chests? Two chests? No, only one chest. One chest. Chest is only one. So there is nothing called right chest. Right side of the chest. If it's a right chest, that means there is left chest also. No, left side of the chest, right side of the chest. So, yeah, region. Then you say right region, right chest region. No, no, right chest region. Not right chest, left chest. It will be there. Then it's not right. Right side of the right region of the chest. That's okay. Appears fine, but not fine. So, fine. Yeah, come on, come on, come on. Write down more sentences. Yeah, and what else you want to write? You can ask me, I'll take you there. We are writing sentences. Sentences. It's not just a letter which I am explaining. I'm making you learn sentences, how to write sentences. She experienced severe pain in the right breast for almost 1 month. Full stop. Correct sentence. Even if we learn 1-2 sentences perfectly, that's enough. Yeah. Initially, Mrs. Kim appeared with the complaint of appeared. Kamal appeared. That means she can appear and disappear. Okay. She visited, you can say. Or she presented, you can say. Appeared. Appeared means it's wrong. Appear means what? Before he did not appear, but now appear. As if a magic. Okay. Appeared is a magic. You can say presented or visited, but appeared is not a right word. So initially, Mrs. Kim presented with a complaint of pain in the right side of the chest. Very good. For which she was advised advised mammography, not for mammography, advised mammography. Her diagnosis was confirmed after the result of biopsy. Yeah, that's fine. That's fine. 2 or 3 minor mistakes I told you, you can correct. Yeah. Any other sentence? Any other point which you want me to show? I will show. Right? Yeah. Presented. Okay. She presented. She presented. That's okay. Was presented means by somebody. Okay. On 18 January, J capital letter Kiran, she is scheduled for procedure. On 18 January, she is scheduled for. On 18th January, she is scheduled for procedure, or a procedure is on 18 January. Scheduling is on 18 January, or scheduled for or scheduled on 18 January. So on 18 January, she was scheduled, or the procedure was scheduled for or scheduled on. Scheduled on means the scheduling was done on, or scheduling was for so and so date. So which day she was scheduled, we don't know. Okay, that we don't need. But when is the schedule? That is important. So it will be the procedure was scheduled for 18 January. Okay. Or yeah. Yeah, planned procedure, right, master? Where 18 January. So all these things. After a month, she developed excruciating pain in the right chest. Yeah. Come on, come on. What else? What else important? Current medical history, recent nursing notes. So anything else you think is important? So next point, which one you want to write? All of you. Next point. Which you want me to take? Which notes you want me to display? In paragraph, body paragraph 1. Mrs. Kim, no need full stop, space is needed. After full stop, experienced extreme pain in the right breast for a month, for which she underwent mammography, reported query breast cancer. So there's a mistake, reported query. Mammography, she underwent mammography, full stop. Then afterwards you can write a new sentence. Reported uh, reported query breast cancer, biopsy taken. Query breast cancer, no, breast cancer was preliminary diagnosed or called signs and symptoms suggested breast cancer. You can say signs and symptoms, signs and symptoms are suggestive of breast cancer. So you can modify the tense accordingly. Yeah, then what is the other point which you want me to take? Yeah, tell me what point you want me to take. Anybody can show me those so that I can take you there. Okay. Not of which Sakir, Mrs. Kim presented with severe pain in the right side of the breast. In the right side, not at the right side, in the right side of the breast. In the right side of the chest. In the right side of the chest, not breast, in the right side of the chest, for which mammography was recommended. Mammography was ordered, recommended, advised, suggested. That's okay. But it is right side of the chest or in the right breast. For which, not of which, for which. Come on, next. Yeah, medical history and medications. Okay. Current medical history and medications. Okay. Yeah. Current medical history and medications. Rija Ravindran. Okay, I gave you there. Yeah, family history, regular medications, and current medical history. Yeah. Occupational history, past medical history, social history. This is past medical history. Which medical history? Past medical history or present? Current medical history. This is past medical history. Okay. Past surgical history. Occupational history. So which one? Family history. Medical history and medications. Okay, let us take this one. Current medical history, regular medications, a recent medical history. Yeah, current medical history or recent medical history. Yeah, we got it there. So regular medications, family history, current medical history. Okay, you can write some sentences using this. Come on. So Anita Pachuvala, Avil Kenwith, Dalvi Yogendra Hafsa, Immaculate Mary, Kamal Takar, Kiran Delhi, Muhammad, Narsabibullah Saini, Rajeshwari, Sakhar, Simiyat, Srija, Sukhvinder, Vinita. Very good. Yeah. Muhammad is good. She is staying till the end. Good. Muhammad is excellent because many guests, they go away in the middle. We have already seen 3 or 4 people going away. And Thakur also is there for a long time. Very good. Okay, regular students will be there, but the guests, they'll come and they'll go like that. But still, these 2 guys are still there. Yeah. Yes. Come on, next. You can write your sentences. Create sentences. That's all. We are learning only sentences. We are not thinking about writing later. Some points I am giving you, but we have to write sentences which are important. Come on, you can write some sentences based on this. Current medical history is done. So regular medications, family history. Breast cancer, mother died. Depression, father and sister. Bipolar disorder, grandfather. Alzheimer's disease, grandmother. So breast cancer, she has a family history of breast cancer. We can think about that one. She has a family history of breast cancer. Or her mother died of breast cancer in 2012. Her mother died due to breast cancer in 2012. Hmm. Okay, Srija Ravindran has been diagnosed to have. She was diagnosed breast cancer. She was diagnosed and hypertension and OCD for the last 5 years. She has been diagnosed. Now diagnosed, she has had. So let me correct your sentence. She has had, and that means doesn't have now. She has a family history, Kamal, not she has had. Mrs. Kim has had, not diagnosed. Miss Kim has had hypertension and OCD for the last 5 years. That means now also she has. Okay. Where OCD? OCD 5 years. No. So 2022. So 2017. So you can say she was diagnosed with not only obsessive compulsive disorder but also hypertension 5 years ago. So this is one way of writing. She was diagnosed with not only obsessive compulsive disorder but also hypertension 5 years ago. Both 5 years ago she was diagnosed, or she has had obsessive compulsive disorder and hypertension for the last 5 years. Okay. So these two sentences you can note down. I told you, quality sentences are quality sentences. And anything else? Socially, she has a family history. Social is different and family is different. Okay. Family history is different. Social history is different. Social history is different. Family history is different. How can you bring socially into family? Rameshwari, Rajeshwari. Her mother died of, no OFF, take off, like that, but not OFF off. OF. Her mother died of breast cancer in 2000. Father and sister went through severe depression and grandparents suffered from bipolar. Please call it. All those, are they important? If they are important, you can write. Breast cancer, okay. But depression is different thing. And bipolar disease and Alzheimer's disease is different thing. So whichever relevant, you can use them. Whatever you feel relevant, you can use them. Yeah. You're writing to update the information. They already know a lot of information. You're just updating the information. Don't they know all these things? They already know those things. You need not write. You're updating the information. So you have to check this word. Whatever they already know, update him regarding the patient's condition. Past history, all they know mostly. Okay. They know most of the past history. Remember that. Sentences we are learning. Okay. Her mother died of breast cancer. Don't they know? Because you are updating the information. What do you say? So this is a letter. This is updating information. Updating the present condition. Because you are only updating the patient's condition now. Okay. Updating the information. That means past they know. Past they know. What you did, they don't know. That you have to inform. Okay. What they already know, you need not tell. Okay. So next, think about these points, these lines. This is a letter which is updating information. Latest ones are more important. This is more important now. 18th January 2022. The recent notes. This is important. Current medical history. Regular medications, they know. Maybe. Current medical history is needed. Okay. Then recent nursing notes they need. And 18th January, what you have done, that is also needed. So focus more on these areas. Okay, preoperative orders carried out. Preoperative anesthesia and informed. Consent done, taken the consent of the patient. HB level checked and it is 12. Preoperation ECG done, showed normal results. So focus more on this. These sentences we will learn now. Okay. These sentences will come in the second paragraph, main body paragraph 2. The main body paragraph 2. So actually this is body paragraph 3. So introduction first, then main body paragraph 1, main body paragraph 2, main body paragraph 3, conclusion. So introduction and conclusion will exclude. Main body is 3 paragraphs. So main body paragraph 2. So I want to ask you one question here. So the question is, are we going in the right direction? What do you think? Are we going in the right direction? Are we getting the maximum benefit what we have to learn? If it is right direction we are going, you say yes. Yeah. Yes, please. Now, preoperative orders carried out. With regard to the present condition, this is it. Okay. Okay. What is that? Activities taken care of, preoperative measures. Okay. So, with regard to the preparation for surgery, preoperative. Okay. What are the things you have to talk about is here. Preoperative measures taken. What is the present condition and preoperative measures taken? That is it. So, this is the recent notes. Okay. And this is preoperative 18th January. 18th January is today. Today. So, you start with today, comma, dot, dot, dot. So, first sentence, what you have to write? Write about this preoperative orders carried out. So, preoperative. So, write one sentence. Preoperative orders carried out. So, this is present tense you have to write. Write in present tense. Present tense. Any present tense, present simple, present perfect, present continuous, or present perfect continuous tense. Anything is okay. Tense you have to use is only present tense, no past tense. Because it is today. 18th January is today. Today is 18th January. You should know that. 18th January 2022 is today. Remember that. Because today's date, you have to see 18th January 2022. If you go to the beginning, today's date is 18th January 2022. So you are talking about today's actions. Come on. First point you will write about this. Preoperative orders carried out. Okay. All the preoperative activities have been performed. All the preoperative activities have been performed, not were. Anita Pachugola, were is past tense. Okay. Present tense. Were is past tense. Change it. All the preoperative activities have been performed as per the directions provided. So write down whatever sentence you want to write, however you want to write, you can modify. All the preoperative activities have been performed as per the directions provided. What you all asked us to do, we have performed them perfectly well. What you directed, we have done. That's it. Now let me come face off. Yeah. Now I want to ask you one question here. Our focus is constructing sentences. Our focus is constructing sentences. Number one. Okay. And second thing is quality enhancement. Quality enhancement. So these are the two, okay, sentence construction and quality enhancement. So how beneficial is this particular session for you? Yeah, how beneficial? You can give from 0 to 100%. 0 to 100%. Whatever score you want to give, that's not a problem. Give something, even if it is 0 also you can give. Okay, straight away you can give. If it is beneficial, we'll go forward. Now, if it is not beneficial, we'll reduce these sessions and we'll take those sessions which are beneficial for you. So just to give your feedback, I just want to know whether we are going in the right direction, whether it is useful for you. Let me get a glass of water. Yes, sorry. All, whenever you use all, it should be followed by the. All is entire. All the preoperative instructions have been executed as per the orders. Wonderful sentence, only one flaw, that is all the preoperative. Okay, all the preoperative. Sukhvinder Kaur, very good sentence, excellent sentence, but there is a flaw, fatal flaw. That is, the is compulsory. When it is unique, you have to use the. The is very special usage. Yeah. Can you grade the quality, please? 0 to 100. I just want to know if it is useful for you. No need to just say excellent simply. Tell me whether they are really useful. Then only I can give you more and more. No? Yes. So Rajeshwari thinks this is good. Yeah. Then next Anita Pachigola, Avil Kamal, Sagar, Sukhvinder, Vinita, and yeah, if it is useful, just your words are important. No? If you feel comfortable, then I can give more sessions. I am giving too much. Maybe you will think this is not necessary. We want only limited. Means we can limit. Na? Huh? So even I am drinking too much water. I'll talk less. Na? Right. Okay. So that's fine. Thank you for the feedback. Yeah. So next. Preoperative orders carried out. This is a very good sentence. All of you note down. Today, all the preoperative instructions have been executed as per the orders. Today, all the preoperative activities or requirements or as per the orders or instructions, it is the same. Instructions have been executed as per the instructions. Okay. All the pre-operative requirements have been performed as per the instructions or as per the orders. So instructions have been executed as per the orders. Little adjust, otherwise it's perfect. Okay. All the pre-operative measures have been executed as per the instructions. That's it. Next. So today, pre-operative instructions are carried out. Full stop. That's fine. Instructions are carried out. That's okay. As per the instructions means again, that's different. So that's why. And all the prescribed investigations. All the prescribed investigations which were unremarkable. All the investigations which were prescribed were carried out and found to be normal. So, yeah, and the capital letter should not be there. If you want to put end, put small letter and put carried out, comma, and all the continuation. Otherwise, remove the end. Okay. The next one. Today, she is prepared for the surgery according to the protocol, such as informed consent was taken and preoperative anesthesia consultant was done. She is fasting. She has been fasting from midnight 12. Midnight means 12 only. There is no need to tell 12. Midnight. Midnight means 12 o'clock is midnight. 12 o'clock afternoon is noon. 12 o'clock, 12 noon. That's it. Noon means 12 in the day. 12 in the night is midnight. 12 in the day is noon. That's it. No need to say 12 when you say midnight. And normal saline 75 ml per hour is started through the new peripheral cannula in the left hand. An ECG has been taken in the morning, showed normal rhythm, and blood test revealed hemoglobin concentration of 12 grams per deciliter. That's fine. Yeah, very good. Okay. So, preoperatively, instructions given were carried out. Instructions which were given were carried out. Instructions which were given were carried out, and the investigations which were ordered were done. Okay. So together you can write. Preoperatively, not only the instructions, but also the investigations were carried out. Finished. Not only, but also you can say. Yeah. Next one, preoperative anesthesia and informed consent done. Information regarding the preoperative anesthesia has been provided and the consent regarding the same, okay, has been taken. Something like that. That's the next point. Hemoglobin is 12, preoperative ECG done, and it is normal. So you can write these sentences. So this separate sentence, this separate sentence, this separate. Write small sentences. Ne? Okay, write small sentences. Pre-operative anesthesia. Okay, inform and in pre-operative anesthesia and informed consent done. So you can write one sentence about this now. You can write one sentence about this now. Yeah. Come on, write one sentence regarding this. So that is sentence number 2. Let us take it as sentence number 2. Then sentence number 3. Hemoglobin 12. Yeah, this is sentence number 3. Then pre-operative ECG done. The results were normal. The pre-operative ECG electrocardiogram which was taken has been unremarkable. Pre-operative electrocardiogram which was taken okay the pre-operative electrocardiogram which was taken has been is unremarkable. The pre-operative echocardiogram which has been taken present tense. The preoperative electrocardiogram which has been taken is unremarkable. Yeah. Write down like that. Whatever sentences you want to write right now, if we practice regularly like this, you get more sentences, right? Hmm. Yeah. Come on, one by one, write down the sentences. Okay. NPO means nil per oral from 0000 hours onwards. From means onwards only. So that is point number 5. That is point number 5. 1, 2, 3, 4. 5. So then last paragraph. Plan. Plan is future. Okay, what next? So this is the last paragraph. Plan is last paragraph. Plan is the last paragraph. The future plan. This is the last paragraph. Main body. Third paragraph. Okay. Now here plan. There are 4 sentences. These 4 sentences you have to write. Number 1 is transfer. The patient will be transferred. Transfer the patient to the operation room or the operation theater at 800 hours. Okay. So 800 hours. This is sentence number 1. You have to write it. Sentence number 1. Then IV can intravenous. Number 2. Intravenous cannula on the left arm. Okay, NS. What is this NS? Normal saline. What is that? NS. What is NS? Normal saline. Yeah, good. Simon sir can understand it. Very good. Come on, all of you. So left arm, which is running at a normal saline 75 milliliters per hour. Yeah, normal saline. Okay, scheduled at 75 ml per liter per hour, milliliter per hour. Okay. Right arm should be avoided. Okay, right arm should be avoided. So the right arm. Always use the before body parts. The left arm, the right arm. Intravenous cannula has been inserted on the left arm on which a normal saline has been running at 75 milliliters per hour, and the right arm should be avoided for this purpose. Operation O small letter Anita. Not by 8 a.m. At 8 a.m. At not by. It is there. You have to see there at 8 hours. So next one. Patient is anxious. Obvious. Okay. The patient might be anxious. Okay. Obviously, the patient might be anxious. So avoid using the word patient. Okay. The patient might be anxious. Okay. Obviously. So that is very clear. Obvious means very clear. Common. Okay. So because of his condition, you have noticed maybe. Then there only the patient needs, the patients might need, might require emotional support. Emotional support is required because obviously he may be anxious because there are chances that he might be anxious, or due to anxiety you can modify according. Emotional support is required because there are chances that he might be anxious. Okay. And next one, closely, the blood pressure should be closely monitored. The blood pressure should be closely monitored. Yeah. So you can write like this. So whatever sentences you want to write, you can write. Modifications, alterations. Okay. Right. The last sentence, based on the aforementioned circumstances, or in view of the above, based on the aforementioned circumstances. Or you can say last paragraph, concluding paragraph. So let us say conclusion. Conclusion. Conclusion, you can start like this. Or you can say in view of the above. In view of the above, comma, in view of the above, in light of the above, based on the aforementioned circumstances. Okay, keeping the above points in mind. Different ways you can write. So study all those points, and anything you want to write, you can write. What is this? Yeah. So what are you going to write there? Uh, you can write what you want to tell them. You can write here. So then you can say what you require them to do. So, or this is to inform that the above criteria have been successfully all the necessary preliminary pre-operative all the uh, measures, all the requirements, all the requirements for the operation have been carried out. This is to inform you that all the requirements for the operation have been carried out as per the instructions. Okay. Whatever you want to write, you can modify and write. And then you can write in the same paragraph conclusion, you can write. In case any additional information, is deemed extremely relevant, please do not hesitate to contact me. In case any additional information is deemed extremely relevant, please do not hesitate to contact me. Then after that, leave 2 lines and then say yours sincerely, comma. Then sorry, leave 1 line and write yours sincerely. Then leave 2 lines. Okay, here leave 2 lines. Then you can write registered nurse or whatever. Registered nurse. And next line is preoperative Once again, this is not everything. We are learning how to write sentences. We cannot learn everything overnight. So gradually, daily, if you attend these sessions, you can learn how to write. So pre-operative care, pre-operative ward, okay, or inpatient ward. Pre-operative unit or ward, or inpatient ward, whichever you feel comfortable. Then St. John's Surgical. If name is given, then also you leave 2 lines because signature is needed. Normally you leave 1 line, and for signature another line. That's enough. 2 lines, whatever it is. Surgical center. So that's it. So now, so that's it. So finally, we are going to conclude the session. It's already 9:30. My goodness. I thought 8 o'clock will take some other thing, but 9:30 already. So we have already had 2 sessions, full length sessions. So we'll see. I'll have my dinner and afterwards, if I'm comfortable, because yesterday I was a little busy, so maybe I need rest. But still, if I have stamina and energy, then definitely I think I'll get back to you. Otherwise, we'll see what to do. I'll message you probably by 10:30 or if I am available. Otherwise, I'll message. If I send a link, that means I am there. Check out at now it is 9:30. Check out at 10:30. If 10:30, you'll get a message. 10:20 to 10:30, you'll get a message. 10:20 means 22, 20 to 22:30. Okay. Yes. Send the link. If there is a class, I'll send the link. So if you get this link, then we have a session. Okay. Now coming to the point. So your valuable feedback, please. I want to know whether how beneficial, what new things did you learn here? No, Muhammad, it's not 1 line or online. It's a 2 lines, always 2 lines. If name is given or name is not given. Because normally you will leave 1 line. And at least for signature, you need another line. Nah? So minimum 2 lines. 2 lines is enough. That's it. And not 1 line, 2 lines. Yeah. So, right. So give your valuable feedback, please. So take 1 minute to grade the quality and to tell what you learned. Okay. Don't just say excellent, good, or something. Let me know what you learned, new things, recall. Okay. Recall and write what benefit you have gained from this particular session. So those who are on the YouTube and contact for subscriptions, because we are starting New Year batch. So you have to contact +91 9877 67360. This is my number. Only those students who can spend the time. Yeah. So give your so this is our lecture which we have done today. Yeah. Andrea Kim. And this is so if anybody is really seriously interested to join and attend the sessions, only can contact me. Number is +91 9877 67360. You have 1 minute to give your feedbacks so that I'll understand how beneficial these sessions are for you. Yes, Sukhvinder Kaur says, so we have got Anita Pachigola, organizing the structured sentences. Yeah, our focus is on sentences, quality sentences, writing sentences and enhancing quality. So Muhammad says, how the idea about writing letter making with sentences. Good. Muhammad, I appreciate you are staying for a long time. That's very good. I really appreciate. So Rajeshwari, I wanted to attend your class till the end, but can't due to the network issue. If I follow your instructions, definitely. If I follow your instructions, definitely anyone can achieve their goal. How? If you follow instructions, how can anyone achieve? Okay, fine. I understood your meaning. Thank you for being my teacher, sir. God bless you. I learned many new sentences. I will can with good. We learned all the aspects of writing from you. Sometimes we are not able to attend your session, but eagerly we are waiting for your precious lecture. Thank you, Sukhvinder. Explained very clearly and nicely. Thank you, Kamal. Kamal is a new student. She is from Ludhiana, Punjab. Most of my students are coming from Ludhiana. Sorry, not Ludhiana, Punjab, they are coming. Habibul, Habibullah, I'm trying to follow the class, but still finding it difficult to organize my letter. No problem. You cannot learn overnight anything. It takes time now. Habibullah is Sunny. Will take little time. You'll definitely improve. Okay. Um, so Habibullah is from Nigeria. Are you from Nigeria, Habibullah? Yeah, you are from Nigeria. According to, if my memory is good, I think if I'm right, you are from Nigeria. Yeah, Habibullah, do you want to share your experience? So, yeah, I also learned that there should be two lines left after yours sincerely. Yeah, you can see the case notes, then you will know. Yeah. Yes, Nurse Habibullah, do you want to share your... I couldn't open that link and write feedback. That's why I sent a message in this. Sorry, no problem. Why should I be sorry? No problem. Wherever it is, the message reached me. That is important. That's enough. I can understand. Take a strong Wi-Fi network so that you can attend the sessions in a proper manner. Then, yeah, Habibullah, do you want to speak something? Do you want to share your experience?
Yes, sir.
Okay, can I unmute? Can I start your video?
Yes, I'm okay.
Yeah, that's very good. People will be happy to see you. You can start your video.
Okay. Good day, sir. Good day, family. I've been finding it difficult to join, maybe due to time differences with Nigeria and India. So at times when I will join, the class might have been halfway gone. So, and I remember the other time when you started the lecture, you showed the writing script, as in the writing paper, how we're going to arrange it. Okay, the first part, how and what is going to be, where the are supposed to be placed, then the heading. So I thought I'll be able to meet up to the also so that I'll be able to get, because attendance so far is only writing that I'm having a lot of issues in clarifying how to write it.
Okay, is there any difference after attending these sessions, at least 10% or 5% or 15%, some difference so that gradually you can learn? Do you find that difference?
Yes, I do. That's why I didn't type today. I was just focused on reading what was sent and observing what is going on in the class.
That's nice. Thank you very much. So can you introduce yourself to our other members? Your name, your designation, where are you working, from which place you are in?
Okay, I'm Sani Abibulai. I'm a mental health nurse. So I work with a private organization in Nigeria here. And I have the aim of traveling out of this country for two reasons. One, for educational progression. Then the second aspect is to work as a nurse in overseas. Thank you.
Yeah, you're welcome. Yeah. So, soccer, grammar, AR, not ER. I learned how to organize and structure my letter as well as grammar, GRAMMAR. You're a good teacher. Thank you. Thank you for the comment that I'm a good teacher. But with all your attention, with all your results, I want to be maybe, if not the best teacher, a better teacher. So from good to better, at least, if not best. So I want to improve. So that's the reason why I ask you to give feedback. Yeah, anybody wants to speak anything, you can. So any new student, Kamal Thakkar or Sukhvinder Kaur, anybody wants to speak, you can raise your hand so that I'll give you the mic. If you want a voice message, you can say voice message, or if you want to come on the video also, it's okay, so that everyone will learn. That would be fine. If anybody is interested, you can speak for 30 seconds to 1 minute. Otherwise, that is the end of the session. So that was the session. Mrs. Andrea Kim, breast cancer, right, and stage 2. And for all the students who are on the YouTube watching later, so this is my contact number. You can contact me on Telegram or WhatsApp or IMO or Roboteam or whatever. So on this particular number, and you can contact for subscriptions. Our subscriptions are open for January 2nd. So January 1st, it's Monday, and new batch starts. So if anybody is interested, you can approach me, and first and foremost, seriousness is required. We are really, really serious, and you want to spend more time and you want to clear, then you can contact me on this number. And so thank you all for attending the session and making it a grand success. Thank you once again. God bless you. Good night.